A major change in the diagnostic manual in psychiatry is in the DSM-5. For the first time, obsessive compulsive disorder was taken out of the anxiety disorders and grouped with a group of obsessive compulsive and related disorders for the first time. And this really stemmed from the work that we did, which showed that different conditions may share clinical features, family history, underlying neurobiology, and common treatments. And based on that, in the research planning agenda leading up to DSM-5, OCD was taken out of the anxiety disorders and clustered with conditions like body dysmorphic disorder, the distress of imagined ugliness, for example, or trichotillomania, people who pull out their hair, or hoarders, for example, people who hold on to things, for example, or skin pickers or nail biters. And that's very important because, one, it turns out that there are many more individuals who have one of these obsessive compulsive related disorders. Two, that these disorders are usually overlooked. People don't ask the right screening questions. If you don't screen for these conditions, you're not going to pick them up. Three, turns out that all of these disorders share common underlying brain circuitry, increased activity of the basal ganglia or the striatum. And four is that treatments that may be effective for obsessive compulsive disorder can also be applied to these other obsessive compulsive related disorders. And then five is because there are common mechanisms across these different conditions, then organizations like the National Institute of Health need to pay more attention because it affects a larger number of individuals. And then the final issue is that the National Institute of Mental Health is very interested in what they call an RDoX approach, a research domain criteria approach, which is to recognize certain common clinical symptoms. The National Institute of Mental Health is very interested in what they call an RDoX approach, a research domain criteria approach, where they focus on symptoms like repetitive thoughts and behaviors. They see how that symptom domain cuts across different conditions like body dysmorphic disorder or hypochondriasis or hoarding or trichotillomania or obsessive compulsive disorder or autism spectrum disorders. That they identify common underlying brain circuits like the basal ganglia or the striatum hyperactivity, and that based on that knowledge or targeting, we can develop new treatments. We can show that the treatments work because they engage the underlying mechanism or the brain target, and then based on that target engagement, that we can develop new treatments that may be helpful across different conditions. So that's the case for obsessive compulsive related disorders or obsessive compulsive spectrum disorders, that we can apply new treatments in obsessive compulsive disorder to these other conditions. For example, we know that selective serotonin reuptake blocking medicines that may be helpful for obsessive compulsive disorder also are effective in body dysmorphic disorder. And we've done studies at Montefiore showing that we can use these treatments for children with body dysmorphic disorder, and that may be very helpful. That wasn't known before, for example. Also, we're very interested in developing new treatments like transcranial magnetic stimulation to target these frontostriatal thalamic circuits in OCD, and we can apply that knowledge across these other obsessive compulsive related disorders. Also for behavioral treatments, it turns out that the most commonly used treatment for patients with obsessive compulsive disorder may be cognitive behavior therapy or exposure and response prevention, and we can apply the behavioral techniques across these other obsessive compulsive spectrum or related disorders as well. Leading up to the DSM-5, there was some controversy about whether or not obsessive compulsive disorder should continue to be classified as an anxiety disorder or whether it should be separated from the anxiety disorder. And grouped with these other obsessive compulsive related disorders. So clearly patients with OCD have anxiety, and clearly cognitive behavior therapy is used in anxiety disorders and it is used in obsessive compulsive disorder as well. However, if you look at the first degree family members, many first degree family members of patients with OCD have one of these OCD spectrum or related disorders, for example. If you look at the underlying neurobiology, the primary brain structure that's involved in the anxiety disorders is the amygdala, the fear center. The primary brain system involved in obsessions and compulsions is the basal ganglia or the striatum. And those basal ganglia mechanisms are also the primary underlying mechanism in all of these obsessive compulsive spectrum disorders as well. And that patients with anxiety disorders respond to a broad range of different treatments. They respond to the benzodiazepines like Valium, for example, or they respond to a range of different antidepressant medicines and cognitive behavior therapy. Whereas patients who have OCD and OCD spectrum disorders respond to a much narrower range of treatments, just to the selective serotonin reuptake inhibitors and not other anti-anxiety treatments, for example, and just to targeted treatments that target the basal ganglia. So things like transcranial magnetic stimulation or surgical techniques like deep brain stimulation to target specific brain circuits that are unique to OCD or OCD spectrum disorders and that differentiate OCD from the other anxiety disorders.